we have two elephants in the room sitting on our chest that have previously been ignored. I had no concept at all of the fact that my breast weight could be affecting the way I was performing. In the last couple of years that I'd been talking to people more and more about their posture and realizing myself that more and more we tend to self-inflict issues because we don't realize we're doing some of these things, and so the impact can be cumulative. If your breasts in total are 500 grams, which would be very small, any weight is a weight, so you're still going to have these physical issues where you are needing to withstand gravity. Then you've got breast movement. It can cause embarrassment, so women will make a conscious decision not to be active, and we now know how fundamentally important that activity level is throughout life. The key thing is just knowing that something can be done, and then knowing what to do about it, and actually actioning, doing something to make that change.
So today I am thrilled to be joined by Siobhan Donovan, aka the Booby Physio. And today we are going to be talking all about breasts, and that might seem a little bit odd for a strength training podcast, but all will become apparent very soon. So welcome, Siobhan, and I just wanted to kind of start with a little bit about, if you can give us a background about yourself and how you've ended up with the name the Booby Physio would be great.
Sure. Thank you. Thank you for having me, Chris. I'm delighted to be here and delighted to be able to talk to you and all of your followers. So I started my life as a PE teacher, wanting to kind of be involved with keeping people active. That's, I suppose, very much been the basis of my professional desire. And after a year of teaching, kind of realized that there was a possibility that some of the movements that we were teaching kids to do in schools may be just kind of something that maybe we needed a bit more information about from a science perspective. So I was teaching back before sports science really was a discipline, and then it was just starting to come in, and I thought, this is really interesting. So I wanted to learn more specifically about sports injuries, and so I went off to the States and I did a master's in the States, and I did a professional qualification over there, which is called athletic training. So it's a sports medicine specific qualification that started in the high school system because their level of activity is so high in their high schools. And then kind of goes through to the collegiate system and into the professional system over there. So basically kind of focus very much on the sports side of things and again, the activity side. And then came back across the water, lived and worked in the UK for about 15 years up in the northwest in Lancashire. At that time, by then I had met my husband, who had gone in to train in sports science. He did his master's in sports psychology. So then we set up what at the time we now realize was one of the first integrated sports science and sports medicine clinics, so that people could come and kind of, I suppose, have almost a one-stop shop from the point of view of injury treatment, but then going on to very much with my injury prevention focus, then going on to kind of further training and so on, if they wanted to. And then moved back to Ireland in 2007, because you might be able to tell that's kind of where originally I'm from. And in doing that, I knew I was kind of going to be moving away a little bit from that sports focus, because just the environment that I've chosen to come to, the population is a little bit smaller. So, but I had also found in the last couple of years that I'd been talking to people more and more about their posture and more about how, and realizing myself that more and more we tend to self-inflict issues because of ignorance, because we don't realize we're doing some of these things, and so the impact of some of these things can be cumulative. So I was having these conversations more and more, and then ended up in London one weekend, went over to watch the proms, and went into a lingerie boutique that I had read about when I'd lived in Lancashire. They're only in London. I went in there because I kind of thought, I'm in my 40s. I've played international rugby at this point in my life. I probably ought to find out about this bra fitting thing that I've read about. And just walked out like, I'm going to say a different person, in the sense that it is what's put me on this road, because I didn't physically have issues at the time because I was training, so in terms of my posture, I would have been reasonably well aligned. I talked to people about being stacked. So I would have had that strength in my back, which is where it all comes from, which I'm sure we're going to talk about. That So I didn't notice so much of a physical difference, but I hugely noticed a psychological difference. So I walked out the door an inch taller, like physically felt, oh my goodness, where is this? And now I realize that it was deloading a weight on the front of my body. Now that I've analyzed it, I understand now that it was taking a weight from the front of my body that gravity has been pulling down, and that I had been subconsciously working hard to resist. Now, I had been managing to resist it, but I know a lot of people can't, because they're not strong enough in that back area. And I went to the proms, and I apologize to anybody who has heard me before, because I say this all the time, but it genuinely is true. If they had said, "Oh gosh, the pianist has taken unwell, we need somebody who can play the piano," I'd have been like, "Yeah, I'll go. I'll get up there. Just give me the stuff and I'll sight read and I'll be fine." Chopsticks. No, I can play the piano, but I would have, I would have been up there. I just felt like I could do anything. I felt like I could take on the world. And that for me was just really interesting from a confidence perspective. I wasn't lacking confidence in the first place, but this brought me to a level of, I think, just knowing that I was resisting gravity and that I was the boss. So I then was sitting there listening to the proms, but going, gosh, if it's doing this for me, what's it going to do for this patient that I had in my head, and that patient that I had in my head, and that patient that I had in my head? So I was then went back and kind of looked at my patient cohort and realized I have a lot more female patients than I have male patients who have back and neck pain. Looked into the whole bra fitting side, and then kind of went, this is crazy. Nobody is doing this properly. I sent my own patients out for to be fitted correctly once I realized that they were all ending up in this position. They were all being pulled forward, despite the fact that I would work on, whatever I needed to work on, and they were doing their exercises, they were doing their rehab, but they were still being pulled down. But suddenly I saw this, and I had never seen it before. So sent them out to be fitted, and then sometimes they came back in stuff that I now recognized was just as bad or worse. So I was like, you know what, if I can't rely on sending them somewhere, I'm going to do it myself. So I went off and learned how to fit, and then put the concept of the internal support, which we do with them through their alignment postural work, and the external support of the bra, put the two of those together to create posture fitting as a service for people. So that, for me, the big focus, I'm going to stop talking after the end of this sentence, the big focus for me is on people being independent in this endeavor, so that they learn how to fit themselves. We have bras that they can, that we use to fit them, and if they choose to buy those, they can, but there's no obligation, there's no guarantee either that what we have will work for them. But what they do is they learn how to do it, and then they can go off into a shop themselves and do it themselves. I'm all about DIY.
Sounds great. And I was hoping you'd say that quote, because I heard it on the podcast I heard you on with Michelle Lyons recently, who we've had on here. But you used that phrase, or that quote, you felt an inch taller both physically and mentally. And I think for a lot of what we talk about with the strength training, it's true. It's not just about the physical, but it's the mental health side of things. And the confidence that comes with it. One thing, because I love to talk, and we mentioned it a little bit before we started recording, about trying to recognise as many different barriers to exercise, whether that's strength training, whether that's running, golf, tennis, etc. And what stops people getting started, and what barriers might they face as they get started. And yeah, I think we mentioned I've learned a lot about menopause recently, and how much that has an impact. And I went to your talk at Therapy Expo back in November, and you made me realise I completely overlooked, or hadn't even thought about, the fact that breast weight could be one of those barriers to exercise. And obviously we've talked about the improvement a well-fitted bra can make, but if we go back a step, what impact does breast weight have on either someone's ability to exercise, or the confidence to exercise because of the breast weight?
So let me first tell you not to feel bad about the fact that you hadn't noticed it, because that would put you in most of the population, and I'm including women there, and I'm including myself because I hadn't twigged it either. And
And you said you were 40 when you first had that
yeah,
fitting.
I was mid 40s. I was mid 40s at that point, and I had been through, in the 90s, elite athlete status. I mean, we were completely amateur, so we didn't have support. I was the physio, so we didn't have external support. We didn't have external strength and conditioning because it wasn't a thing then. But at the same time, I had no concept at all of the fact that my breast weight could be affecting the way I was performing. So it's something that I think, and this is a slight aside, but I'm going to say this now. It's something that I think women, because our breasts grow in puberty and they are part of us. We live with them. We absorb them. We don't necessarily notice them unless they are something that physically impact somebody, and then at that point, and that is generally larger breasted people, and at that point they will become aware of it and they may go looking for something to try and support themselves, or that is the situation in which people will wear two bras to try and prevent the movement that I'm going to come on to. So basically what happens with breast weight is, well, not necessarily breast weight, but breasts move in three planes. And we now have research showing us this, where again, previously it wasn't considered important enough to even be acknowledged. I know the University of Portsmouth, there's a fantastic group down there, and they've kind of been spearheading, I suppose, a lot of the research, and also the breast research unit in Australia in the University of Wollongong. But initially, when the head of the unit in Portsmouth, Joanna Wakefield Skur, when she was submitting papers, she was being rejected. Her papers were being rejected because it wasn't important enough, because there wasn't an understanding of this impact. So you've two things in terms of the breasts, in terms of their impact. One is the weight, and the weight is a physical load that is going to go downwards, because that's what gravity is going to do. So gravity is going to pull downwards, and gravity is also, in doing that, going to pull us forward. So that's one of the impacts, the physical load that either we can overcome by being strong enough in our backs, because our pecs do not support our breasts at all. I don't know if you know about I must improve my bust. That was a line that came from a book which has been made into a film, and even the author of the book said, no, it doesn't improve your bust at all. It was just something she had made up, but it's kind of gone out there as people thinking, work on your pecs and it will change your breast. It won't. It'll change your pecs. So yeah, still a good thing to do, but it's not going to do anything in terms of breast, because there is no muscular support for our breast weight. Basically, it is supported by our skin. So the only thing holding our breasts high on our chest wall, which is where they start, is the skin. And the skin is going to stretch, because if you put a load onto something that is elastic, it's going to pull and stretch that elastic. And that's what happens over time. And that becomes more evident and more extreme during menopause, because we lose that elasticity even more so during menopause, or it becomes more evident. So you've got your breast weight, which is this physical load that women literally have to put up with day in, day out. And as I said, sometimes they're aware of it and, do things to try and support it. Sometimes not very well, but they at least are trying. But most of the time, and this is where I'm going to include women who consider themselves to be smaller breasted. I constantly have conversations with people who, when they hear now what I do, say, oh, that's not relevant for me, I'm really small. And I say, any weight is a weight. So if you have a 500 gram weight and you put it around your neck, it's going to pull you forward. So if your breasts in total are 500 grams, which would be very small, that would be more kind of pubertal, then that's still a weight pulling you forward. So any weight is a weight. So you're still going to have these physical issues where you are needing to withstand gravity. And it's a question of whether you're aware of that or not, and whether you have done something about that from the point of view of a sustainable solution, which is strengthening the muscles in your back. So that's the first thing, breast weight. Then you've got breast movement. And breast movement, we now know, thanks to the University of Portsmouth, is in three planes, in three directions. So the breasts move up and down vertically, which is the bit that people tend to know and will see, so the iconic thing of Pamela Sue Anderson running down the beach, breast weight goes up and down. That's the thing that's most visible. But what we also know, and what's really important, is breast weight goes sideways. So it goes from side to side, and it also goes in and out. So it goes inwards to the body and away from the body. And the further away a weight goes from the body, the greater the load and the more likelihood of it being pulled down. So when somebody is moving, that breast weight can now also create pain from the point of view of the load being moved in these various directions. But also it can cause embarrassment. So a lot of women are not comfortable in an environment where they feel their boobs are moving excessively, uncontrollably. And so what they will choose to do is to not be active, because they don't want anybody either seeing them and possibly being cruel, which happens right from school age. Happens with, and it's not boys necessarily very often, it's girls having a go at other girls, to the point of running outside and being catcalled. And that's not only building sites, that's not only where that happens. So women will make a conscious decision not to be active. And we now know how fundamentally important that activity level is throughout life, for all of the positive reasons that we know, for all of the the anti-aging, as opposed to buying a serum that costs €1 million. We know how important that is. So to have this barrier to women being active that is so easily solved is really, really heartbreaking for me, because and I suppose this is my mission, is I've now seen it, and I know we can resolve it in the vast majority of cases without surgery. And so we just need to be doing it.
Coming back to the breast weight, I heard you talk before about, firstly, like the average breast weight and how you then tend to link it in with something people understand. And I think you mentioned you've got Jack Russell across your chest. Yeah.
This is my Jack Russell. Yeah. So basically, now obviously you can have a smaller Jack Russell or a bigger Jack Russell. So the analogy is fairly, but it kind of gives the idea, at least of, and it's interesting. I have some silicone breasts that when I go to conferences and things, I bring along, and people feel them, and people always go, "Oh my goodness, like how heavy are these?" And that's what we're carrying all the time, but we just don't appreciate it. Like literally, if somebody puts their hand under their breast and does that, it doesn't feel like anything, because our body has, it's attached to our body. But when we actually take and see what that amount of weight is, it's very significant. And people used to talk about it in terms of bags of sugar before, because that was kind of the analogy that was most appropriate for people. Now, what's absolutely lovely is people are now, and this happened to me, and I spoke at the Every Woman conference festival in Cardiff, and I had a woman who came to the table that I was at, and she felt the boobs, and she put them in her hand, and I need to put my hand where you can see it. She did an overhead press. That's what she was doing. And then she did a lateral raise, and she held them out to the side to try and work out what the weight was based on the weights that she's used to using in the gym. And that was just lovely for me, because I thought, this is brilliant. This is somebody who's relating that breast weight to something that they do several times a week, which is, use these weights in the gym. You can still relate them to a bag of sugar. You can still relate them to a bag of flour. But at the end of the day, they are heavier than everybody realizes. And again, I will come back to small-breasted women. They are still heavier than they realize. And that still needs to be supported. So the consequences in terms of the impact are very often more obvious to larger-breasted women. But those consequences are still happening for smaller-breasted women.
Yeah, and I remember in the having read through back my notes from the Therapy Expo talk you did, that you talked about a paper, I think it was Burnett and et al., and it was saying that only about 33% of women are actually meeting the physical activity guidelines, and one of the fourth highest reasons was breasts, for the reason why they didn't feel comfortable exercising or weren't meeting the guidelines. And you said there's actually no difference in the participation levels for women with larger breasts versus smaller breasts.
Yeah.
They were still about level with the percentage of meeting the guidelines or not.
So the other thing with that study was 2016, and that was the first time that breasts were included as a reason. So, when they do these studies, very often it's a tick box. Why are you not exercising? Cost, facilities, health issues, tick, tick, tick. And it was the first time the breasts were actually included. And they came to be, as you said, the fourth highest reason, higher than cost and facilities. So people were finally going, yes, this is the reason why I'm not active. They were able to acknowledge that. And I'm sure that there will have been some women who kind of went, that actually is the reason why. I've never known that that's the reason why, but I don't want to go for a run because I don't want my breasts to be moving. But they'd never had the opportunity to even say that before. So yeah, and it was 33% of those women who were not reaching the recommended guidelines. So when we look at that from the context of overall health and overall longevity or quality of longevity, which I think is far more important than quantity, then that's a massively impactful stat that again we can improve.
Because we talked a little bit about the embarrassment of movement and the excessive movement of breasts, a bit about the breast pain, and again, obviously, why that would put people off. You also mentioned for some things there's almost an inability to perform the tasks you want to do, and you use the example of golf and tennis. And why would breast weight or breasts be a reason that they can't move in those ways?
Yeah, so rotation, the ability to rotate, the ability to turn our trunk is fundamental to quite a lot of sports. So tennis and golf would be the ones that are the most obvious because you see people doing that. But it would be in other sports as well, in terms of, for example, in netball, reaching out to catch a ball at the side as opposed to a ball that comes in front of you. So not everything in our lives is in front of us. So we need to be able to have that movement. And if your breast weight is poorly controlled, you will turn your body and then your breast weight follows with a bit of a delay. And the same goes for impact. So actually when we land, our body lands and then the breast lands like a millisecond later. So that can give pain. That's called breast slap, and well, actually it's the acceleration and the deceleration involved with that can give pain. But also from the point of view of actually physically being able to turn the body around, holding an item, whether it's a racket or a golf club, and then to be able to get enough range of movement to be able to do your swing. And again, we could look at any of the racket sports with that. We could look at squash, we could look at badminton, loads of people now doing paddle. All of those activities require the ability to rotate. And if you physically have a Jack Russell in front of you, like try playing squash with the Jack Russell strapped to your chest and see how you get on with that. It's that kind of a concept that physically it can restrict your ability to bring your arm across your body because of size, but also positionally. When breast weight is underneath our armpits, which is where it goes when it's not well supported. So everybody thinks it goes south, but it goes southeast and southwest. So it kind of hangs underneath your armpits. In doing that changes your ability to primarily to move your shoulder joint. So there's an impact there with that. But also the other thing that's kind of interesting is thoracic rotation, which is that ability to turn, is inherently linked to the pelvic floor function. So the way the pelvic floor functions is affected by your ability to rotate and also affected by your ability to go forwards and backwards in your mid back, because that affects breathing. and your breathing and your diaphragm affects your pelvic floor. So it has these knock-on effects on bits of our bodies that, again, women don't realize. And there are a lot of women who suffer with leaking during exercise, or even just stress incontinence, which is leaking that, or urgent incontinence that may not be related to exercise at all. And some of that may come down to breast weight, but they haven't realized that because that information hasn't been something that's been out there. Hence me shouting about it.
And is it more partly from what you just said there, but also partly the breast weight then affecting the posture? Because again, if anyone slouches and then tries to rotate, or like you say, take a deep breath in, it becomes a lot harder to do. And I suppose because one of the strategies you said, women often don't participate in sport as a strategy to get around it. For those who do, am I right in thinking that there's a lot of people have a subconscious leaning and rounding forwards to almost hide the movement of breasts as exercise, and then which is then confounding the problem in terms of posture? Is that right?
100%. So posture is basically the vehicle through which a lot of this impact can have its negative consequences. So yeah, you're absolutely right. If you think about the physics of having a weight on the front of your chest, and the prosthetic ones that I have, people will put on and then kind of go, oh my goodness, is this what I'm carrying around? They'll kind of get that concept, and it's great for men to put them on and see what it actually feels like. But when you have that load, the most obvious is that load is going to take your whole body forward, your whole torso forward. But you're absolutely right. The shoulder joints, and which are then connected to the shoulder blades, they are going to be taking more of the load when it's poorly supported, because straps try and take the load in the bra if the bra is not optimally fitting. So then as a result of that, you're being pulled into this forward position, which we know is internal rotation, and a position called protraction, which is coming forward here. So what we've now got is the muscles in the shoulder blade area being lengthened to their fullest capacity and then being loaded in that position. So they don't like that either. And that has consequences on the spine, because that's where those muscles are kind of attaching. And that load and that positioning is then something that we adapt to. So the muscles at the front of the chest become shorter or more tense in this position because they've been held in this position. So they'll then become tight, so that if we then say to somebody, can you bring your shoulder back? They actually physically find it really challenging to do that, because the muscle here has tightened as a result of the muscles here letting go. So we have that, that kind of knock-on effect of, because the muscles in the back are not strong enough to be able to hold that load, the consequence at the front is a tightening, which then makes it more difficult to come back and up and into that position. So to your point, two things will happen in terms of the consequences of that. One is, if women let their breast rate go, and that is what they do because they don't know how to support it otherwise generally, then you'll get that change in the shoulder blades and in the shoulder joint, which can then impact your shoulder. So if my shoulder joint, if the ball and socket is in this forward position, I'm now limited by how much I can move my arm. So I'm immediately restricting my ability to do things. And exactly as you said, if I'm in this slouched position, my head is going to come forward. Now I can only turn my head this far, as opposed to if I come up to here, now I can turn my head this far. So our ability to rotate, our ability to move, not necessarily only rotation, but it's based on being in that more stacked position. So posture is the vehicle through which we function, and we can function well or we can function poorly based on how we are aligned. But the other thing that women do is, if they do decide that they're going out and going to say go for a run or do an activity, and they recognize that their breast rate is something that is causing them some issues, what they'll do is they'll hook their hands underneath their boobs and they'll try and keep their boobs still, running like this. Now, that's now creating issues up here. So I'm immediately shoulders up into my ear, So that's not very comfortable. I'm not going to last very long. I'm going to give up. And that's what happens, unfortunately.
Yeah,
But
and
all
you,
retrievable.
yep, and we'll come on to that. And it because you got us to try that in the session or the conference you did, and I'd challenge anyone who's either watching or listening to this is to try those few things of sitting in a slouch position, trying to raise your arms as high as you can, try and take a deep breath in, and then try and turn the neck, and then sit up straight, and again try and raise your arms and see how much more movement you've got, how much of a deeper breath you can take, and how much more you can move your neck. And then, like you say, when you relate that to sport, when if we're getting out of breath, we want to take deeper breaths to to feel the body. We want to be able to move more freely,
Yeah.
and also we don't want to be rigid all the time. We want some natural bounce in the body and give and take. And
Yeah.
if we're having to stay rigid, I imagine that again is why we can have a potential impact and increase in pain, or whether it's back pain,
Yeah.
neck pain, etc.
And it's also the enjoyment of the activity. So like you say, if you are kind of holding yourself into a rigid position in order to try and do what you think is the best option, which it is, for supporting, it's the best option without the other options, then that's going to affect your enjoyment. And one of the things that we have in terms of evidence is how much more people enjoy an activity when their breasts are well supported. Sometimes people don't realize that the reason why they're not enjoying an activity is because their breasts are not well supported. So again, those people will fall off the sport and the physical activity spectrum because something is they're just not enjoying it. They're just not happy. Why am I doing this? I'm just going to stop. And we're seeing that happening in teenagers. We're seeing that happening in girls dropping out of sport. So they drop out of sport at twice the rate of boys at the high school level. Now, there are other reasons. There are periods. There are, concerns over body image as a general concept. But again, thanks to the University of Portsmouth and the research that they've done, we now have evidence that tells us that yes, breast weight is something that girls are concerned about, and they were like, yeah, my boobs move too much. I'm not going to do PE today because my boobs are moving, and that's not always pain. That's very often, more of a confidence, again, body image situation. So that perception of what somebody else is seeing is as important as what somebody is feeling in terms of the physical side.
And that brings me nicely on to the next question I had was, you mentioned not only does posture change have an impact on things like pelvic floor function, lung capacity, and the things we've already mentioned, but you also said it has a direct link on mental health. And I suppose there's
Yeah.
the confidence level and the confidence you felt just by being supported better. Is it more the confidence, or has it got an impact on, say, depression and anything along those lines, and anxiety?
So this is again where it links back in very much to posture, in the sense of, if you consider that breast weight affects your posture, we know that posture affects your mood. So if you are feeling kind of low, whether that is through clinical depression or through just emotional change, or stress in your life, then very often the feeling is it's just hard to be up. So what we do is we fall into ourselves. And then if we fall into ourselves, then what we're doing is we're accentuating that situation where gravity is winning, and where then it's harder to come out of that position. So yes, we have evidence that shows that posture is affected by mood and by position. So mood is affected by posture. So there was a couple of studies done where they asked people to recall positive memories and to recall negative memories. And it was easier to recall the positive memories when they were in a positive posture, and it was easier and harder to do the negative. And it was easier to recall the negative when they were in a negative posture, and harder to recall the positive. So we do know that there's a link there. There hasn't been specific, to the best of my knowledge, there hasn't been specific research done on breast weight affecting mood, other than the plastic surgery field, so when somebody has a breast reduction surgery, the surgeons obviously look at what are the reasons that you are having this surgery for. And it will be things like people feeling their postures poor, having headaches, having back pain, having neck pain, inability to function, unwillingness to participate in activity. It'll be all those things we've already talked about, but it'll also be low mood. It'll be anxiety. It'll be stress about breast movement. It'll be all of those psychological factors that affect their ability to live their lives well. And then what happens is post-surgically, those surgeons will revisit those patients and get the impact. And they have shown with their surgery that that impact has been lessened, that psychological impact has been lessened. So people's mental health has improved as a result of having surgery. Now, can we do this without a surgical solution? Yes, we can. But that I guess is our evidence that changing breast weight can impact on your psychological status.
And before we started recording, you were talking about, in terms of who you see for fittings, majority tend to be postmenopausal. You said the majority of breast reduction surgeries tend to be in postmenopausal women. So I would like to say a little bit around that. But beforehand, actually, what changes to the breast happen during menopause? Is there much of a change, and does that then kind of exaggerate some of the things we've already talked about in terms of confidence around breasts?
Yeah, so we have changes to our breast weight throughout our life cycle, and again, this is not necessarily something that women are aware of. There are obviously the girls will become aware of their breasts developing, so that's your first stage. During the menstrual cycle, the breast changes as a result of the hormonal fluctuations. So the breasts will get bigger as we're coming up to our period, because basically that is the body's preparation for the possibility of pregnancy. So it is preparing itself for the possibility of creating milk, and therefore it gets slightly bigger. And then once we have our period and there is no pregnancy, then the breasts get smaller again. So there is that little bit of a fluctuation. If the breasts get bigger and pregnancy does occur, then they continue to prepare for breastfeeding, and they get bigger over the course of the 9 months, which is definitely a time when women become aware of that, and is usually their first time being aware of breast changes. But exactly as you've just said, menopause also creates changes because, again, of the hormonal fluctuation. So if you think about all the things I've said, puberty is a hormonal storm. Pregnancy is menstrual cycle is a hormonal, maybe storm is perhaps a strong word, but it's a hormonal time. This is all down to fluctuations in hormones. And then we've got that happening at menopause, where hormones are changing, and then we may be looking at assisting our hormonal changes through, for example, hormone replacement therapy, or whatever they're calling it now. It's MHT now, isn't it? But looking, because it's not so much replacing hormones as supporting them. But when we are absorbing hormones into our body, then that's also going to change what's going on at our breasts. So our breasts very often get bigger in that kind of menopausal transition. And for women who have had breasts, and I'm not going to say larger breasts, I'm going to say breasts that have bothered them earlier in their lives, because it isn't always larger, but I guess it's more obvious with larger breasts to those women. When they then have their breasts getting bigger, if they recognize that, then very often they're like, I've had enough. I'm just not dealing with this anymore. And unfortunately, their only awareness of a solution when they go to their GP is surgery. So what we're finding is that the cohort that is most commonly having breast reduction surgery is women in that postmenopausal age. And it's potentially for a variety of reasons, which may be economic as well, which is potentially that they no longer have dependence. And mind you, once a dependent, always a dependent, I think. But that they're not in that situation, so they may have a bit more disposable income. They may have the opportunity to be able to spend some money on themselves. But also, and and we do, I think in menopause, we do reach a point of, this is just not right anymore. I need to start doing something to make a difference here, as opposed to, I think sometimes we put up with stuff, and that's a bit ingrained, in terms of just societal norms and so on. Whereas now I think it's nice that people are standing up a little bit more and are kind of realizing, yeah, I don't have to put up with this. But sometimes people have reached their 50s and 60s before they kind of go, okay, I'm going to find a solution. What am I going to do here? So those changes become something that either somebody then puts up with continually for the rest of their lives, and then obviously with aging, the breast weight is changing in terms of position, which is then accentuating the likes of the thoracic kyphosis. I mean, it drives me absolutely insane that women accept the fact that we get smaller as we get older. I've gotten taller as I've gotten older because I've learned. Now, I haven't physically gotten taller. My spine is my spine. It hasn't changed in terms of its length, but I have actually been measured for my height, and my height has increased because I stand with my spine stacked the way it should be, and because I'm not letting gravity do this to me. So this concept that we get smaller as we get older has been accepted because that's what's happened, as opposed to, it doesn't have to happen. Yes, again, there are hormonal changes which affect the vertebral column. Yeah, fair enough. But not to the point that women lose the height that they do lose. And the osteoporosis side of things is obviously something that we're really, really keen around menopause to try and prevent. But we can start preventing that from a much earlier age if we start to think about the alignment and we start to think about how strong we need to be throughout our lives. So, starting that strength training at an earlier age means that when you get to your menopausal period, you're not needing to start. Now, it's never too late to start. So obviously, if you haven't, then great, get started. But if we can encourage people to be more active from an earlier age and to keep being active, then I think the health burden that we are seeing that belongs to the older, to my generation, to the older generation, is going to be lessened, because we will have fewer issues. So I might be cutting the noses off of physios, which I apologize for to some extent, but the fact that we can help people to have better quality of life and to be able to be more active is not something that I'm going to apologize for.
So hopefully there's some women that have been watching this far or listening this far that might recognise that breast weight is an issue for them, whether they knew it or not. And they're now thinking, okay, well, that's great, I understand it, what can I do about it? And I thought you've alluded to it. I think 2 solutions or strategies as a main part that I can gather, but there might be some more. But it sounds like it's start strengthening particularly the back muscles along with the rest of the body, and a well-fitted bra. So could you, are they the only sort of 2 main sort of strategies, or is there any more on top of that? And then we'll start to cover each of those.
Yeah, so I suppose the most extreme response to changing breast weight is breast reduction surgery. And what concerns me about that is the fact that it's the only thing that gets offered to people, because currently it's the only thing that people know about. So when people hear that there is what we call a conservative or a non-surgical solution, when people hear about that, it does tend to be the postmenopausal or menopausal cohort of people who get in touch with me, because they're the ones who kind of relate to it the most and are most, I guess, which is not to say that people at all ages can't benefit from it. But that surgical side, if you think about the logic of what happens, they are physically removing some of the breast weight. So they're making the breast weight smaller. But all of the issues that we've talked about with breast weight support are still going to happen to somebody who's had surgery. So what you're doing there is you're putting a plaster on the issue, as opposed to helping somebody to be able to manage breast weight. And I think that's a really important word. It's about learning to self-manage breast weight through the resources that we have to hand. And the resources that we have to hand are our body. So exactly as you said, that strengthening. And what that strengthening does of your back area is that's going to give you, and when I say back, I also mean shoulders. So the posterior aspect of the shoulders, shoulder blade. So all of that supportive structure that helps us to come out of this forward position. So all of those muscles in the back. And of course, they're affected by your glutes, and your glutes are affected by your hamstrings. So you're right, it's the whole of the body. But with the focus being on the back of the body, not on the front. Because people sometimes think, oh, I'll just go to the gym and do some pec stuff because my pecs are going to support my breasts. They're not. There's no physical connection between the pecs and the breast weight other than the breast lies on top of the pecs. So we have the chest wall, we have the pec muscles, and we have the breast lying on top of it. But there's no integration, there's no support. So we have that internal side, which is alignment. So I talk to people about the concept of dipped headlights. So if we allow gravity to take our breast weight, it's going to pull it downwards like that. If I lift my torso up, it's going to bring my breast weight to what we call full beam. But if I let my torso go again, my breast weight's going to drop down to dipped headlights. And that's a catch-22 because that's my breast weight pulling me down. So now I'm in dipped headlights. But if I can resist that, I'll come to full beam. If I go and buy, and if I find an optimally fitting bra, and I put the optimally fitting bra on my dipped headlights, that's going to bring my breast position to full beam by physically moving the breasts up the chest wall. So that's what the external support does. It physically lifts the breasts up from the floor, from the direction of the floor, not the floor itself. That'd be very extreme. From that direction, physically moves the breast up the chest wall. So what it's doing is it's trying to replace that skin by creating this external support. So if you take the two things, you take the alignment situation where you're going from there to there, you take the external support situation where you're going from there to there, you put the two of them together, you end up in high beam. So you end up with the breast weight, instead of being downwards towards the floor, it's actually, now if I say pointing up towards the ceiling, people think, oh my God, I don't want to be pointing up towards the ceiling. But it's a question of down versus straight versus slightly up. Now slightly up makes it harder for gravity to grab hold of it. Because even at full beam, gravity still has, I can get those and can still pull you down. Whereas when you're up here, gravity has a much harder job to get at something that's at that angle. So then you're ending up with a more sustainable solution. So for me, it's that combination of external and internal. You will get improvements with external, you'll get improvements with internal, but put the two of them together and your improvements are far more sustainable.
And it is making me think there with the strengthening the back muscles, and I sort of refer to them as the pull muscles. They're, because we're trying to work them by pulling against resistance, and I tend to find that is the first group of muscles to lose some of their strength, because if anyone's tending to do any kind of body weight exercise or just got a few pairs of dumbbells, it's actually then quite difficult to strengthen those muscles. If you get your body in the right position, you can use dumbbells in a bent over row or something like that, but most people are just then doing the press exercises, which then is more sort of, let's say, anterior shoulder or front of the shoulder in the chest. And yeah, so resistance bands tend to be really helpful for that, but most people don't tend to think of that. So yeah, it tends to be the first movement pattern that loses its strength, and therefore the back muscles, and that's holding up against posture.
Yeah.
In terms of then options around having a better supporting bra, you've kind of obviously mentioned the fitting service you offer, but I suppose there's probably different levels to what women can try to help. So you sort of mentioned about sort of tips and strategies that they might use to try and kind of manage it themselves, and if that's not working, what are the better options then for them to actually have a more in-depth, thorough bra fitting that would support their needs?
Well, being very biased, I'm going to suggest that they should get in touch with me in terms of the service that I've created, which is called Posture Fitting, which does that. It links the internal and the external. So what we do is we look at somebody's alignment. We're not trying to make people perfect. We're not trying to make them rigid, and that's really important. And like you said earlier, if you're rigid, you don't move freely. So what we're doing is we're just explaining to people that concept of how you function better if body areas are aligned. So if your head is over your ribs, if your ribs are over your pelvis, then we get all that better functioning of organs. So we look at that and we help people to be able to, again, what's really important is for things to be sustainable, because everybody can, and I know there will be people listening to this podcast and they will now be sitting up straight because I'm talking about posture, but then they'll find it hard to stay there. So it's then about how do you manage to maintain that alignment, and what are the things that you can do. So small little kind of tips and tricks, like the chair that I'm sitting in there, that's a really high backed chair. I'm leaning back into the chair, so I'm not having to work to stay here. So it's no effort for me to be in this position. But if my chair doesn't have that high back, then it's a harder situation and I'll probably end up here. So it's just little kind of tips and tricks really in terms of cues to get into that better alignment, but then also how do we stay there. So then from the bra perspective, I'm all about DIY in the sense that I want women to know how to fit themselves with a bra. And I want them to be confident in knowing what fits them, because it's not just about going to a shop to buy a bra. We should fit ourselves in a bra every single day. And if we do that, and if we know how it fits, then we know when it doesn't fit anymore. So we know if we're pregnant, that we need to change the bra that we're wearing, or we know if we're postmenopausal or anywhere in the menopause transition, that's not fitting me anymore because that wire is now in the wrong place. How do I adjust for that? So there's some adjustments we can do on the straps, which might allow you to be able to, or with the band, because the band usually has 3, if not 4 hooks. So you may be able to change your band position to get the wire sitting where you want the wire to be, because the wire is not the devil. Everybody hates, not everybody, but a lot of women say they hate and they will not wear wired bras because they're uncomfortable. But they've been uncomfortable because they've not been fitted correctly. So when you are fitted correctly, a wired bra is just as comfortable as wearing nothing, because you're not aware of it. I don't know I'm wearing a bra right now. I'll get into bed at night sometimes and I've still got it on because I've forgotten to take it off, because it's that comfortable. So it should be like a second skin. So if somebody is constantly fidgeting and poking and pulling and readjusting things all day, that's a poorly fitting bra. So what we do is we teach people how to recognize what a good fit is, so that you recognize what a poor fit is, and then at any time in your life you can make the changes that you need to make, because the bra is not fit for function anymore. And that for me is also really important with sports bras. It's brilliant now that there's a conversation out there that it's where people are talking about sports bras and they're talking about how important they are, and that's great. And I'm really pleased that topic of conversation is no longer taboo. It's being spoken about. But it's more than just sports bras. We need to be supported all the time. And also, it needs to be not just a sports bra. It needs to be an optimally fitting sports bra. Because if somebody goes and buys a sports bra because somebody has said they should, but they buy one that isn't optimally fitting, they're not in a better situation than they were in before. Their breast weight is still not being managed correctly. So we need to learn how to do this for ourselves. And, I've talked to people a lot about where should we learn this? Where should we be learning it in school? And having been a former PE teacher, I would say, yes, it would be great to learn it in school, but that it's not, is it the school's responsibility? There's a lot of argument in that, and can they fit it into the curriculum? And is it, of course, it's important enough that it should be fitted into the curriculum. So the school is the ideal environment, because you've got that situation where you have girls together and you can therefore do that teaching of them. If that situation doesn't happen, then other environments where you get a group of girls together or a group of women together, the likes of sports clubs, the likes of women's sheds, the likes of WI, those kind of organizations, those are great environments for us to be able to go and teach people how to do this. But this is also the reason why I'm doing it via physios and therapists, because if you're coming in to see somebody for a back problem or for a neck problem, then that's an ideal opportunity for somebody to teach you then how to be able to add this extra bit of information into your life to then be able to prevent problems from happening in the future. So I think, sorry, I've gone off the point here now, but I think disseminating that information is still a challenge. And we need to find environments in which to do that, because, you know, we can say, oh, you could be taught it by your mother, but that's not always a situation that everybody, you know, that will happen. And to be honest, at the moment, our mothers don't know this information. So they can't pass it down because they haven't been taught it themselves. And similarly, you know, mothers of the current generation can't pass it down to their daughters because they don't know about it themselves. So at the moment, we have a lot of work to do to try and get that information out there. But I firmly believe this is something that should be part of a woman's toolbox in living her life, that she knows how to fit herself. And the other thing that's really important with that is, when you put your bra on every day, if you fit yourself into it, and it's just a couple of small techniques, you are feeling your breasts every day when you do that. So that's a breast check of a sort. Now, I'm not saying it replaces the full 4-quadrant breast check, which should still be done. But, you know, you've had Michelle on, and I love the phrase that Michelle uses about me search, about knowing your body, knowing what your body feels like, so that if something changes, you recognize that. So every day when I put my bra on, I reach in underneath my arm to pull my breast tissue into the cup, so I can feel my breast as I'm doing that. And if one day I feel it and there's a little bit of resistance and there's something there that I'm going, oh, what's happening there? So then I'm going to investigate that a little bit more. So effectively, I am, you know, creating a better blueprint of my body, so that if I feel something that feels out of that normal, then I can act on that. And I think that's the bit for me that's really, really important. I want women to be independent. I don't want women to be in a situation where they are relying on somebody else to tell them whether something fits them or not. Why don't we know this ourselves?
And it's a good time for you to kind of share some of your sort of links, and I imagine you've got some resources on your website on that, but also where people can find, because it's not just you, is it? You've got a network now of fitters across the UK.
Yeah, so what I've done is, I mean, I started offering the service to my own patients and then realized very quickly how impactful it was, how much of a difference it was making for people. But also, you know, once people hear about it, then they realize there's something that can be done. So I then needed more people, because I would have somebody saying, oh, my cousin is in Wales, or my aunt is in London, or whatever. So I now train other therapists in being able to offer posture fitting. So I have a network that currently is covering Scotland, England, and Ireland, and New Zealand. So if anybody's listening from New Zealand, we have a posture fitting partner out there. And also I have people waiting on training in the States and in Canada and in Bermuda. But if anybody is listening who is a clinical therapist, I am very much looking to get this service to be available to more women. So if anybody is listening that is in an environment where they would be able to offer it, if they have that clinical background to be able to do the biomechanical side of things, then I would love to hear from them. But certainly from the point of view of women who may be listening to this, who are relating to it and who are going, yes, this is something that I'm now realizing I could improve upon. If we don't have a posture fitting partner near you, which you can see on the website, which is posturefittingphysio.com, then we do virtual consultations, and they work extremely well. So I've done one of those with somebody in New York. I've done them with people, you know, more locally, but they can work extremely well. So that we will always find somebody that will be able to help you.
Brilliant. And I'll put all the links in the show notes of this, or in the YouTube description for anyone to find there. In terms of social media, is there sort of preferred channel that people can get hold of you on then if they wanted to ask any questions?
Yes. So currently my social media is posture fitting. So Instagram is posture.fitting. But basically it's all under either my name for LinkedIn, so Siobhan O'Donovan, which nobody now knows me as. So I do need to change these things to the Booby Physio, because obviously that would be easier for people to find. But yeah, currently posture.fitting on Instagram and posture fitting on everything else.
Amazing. So I think
I'm going to say one other thing,
go on.
Chris. Sorry. The other thing that I having lived in the States where you'd be driving along the road and you'd see these billboards and it says 1-800 call me or 1-800 injury or whatever. So they've been free, and this was 40 years ago that I lived there. That's always been an easy way to remember a phone number in the States. So when I came back to Ireland, I looked specifically for the phone number that spells the word posture. So my phone number, so our prefix is 087, 353 for the country code, and then the prefix. But my actual numbers in my phone spells the word posture. So if somebody looks at their phone, it spells out the word posture. And I realized after I started, that was where I started, obviously with the postural side. And then once I diverted into the breast side, I did actually look it up to see if I could get 087 boobies. and then I thought, perhaps not, just in case I would get calls that I didn't want, which is an unfortunate, indictment of modern life. But I figured that probably would happen. So yes, 353, which is the Irish country code, 87 posture.
Amazing. Yeah, it's easy to remember. Good. Well, I think we covered everything that I was wanted to cover, and probably more. Is there anything else that you think is important to share that we've not covered that's often overlooked?
I think we've probably covered it all. I think the key thing is just knowing that something can be done. And it is these kind of platforms, so thank you, that allows me to let people know that something can be done, and then knowing what to do about it, and actually actioning, doing something to make that change. So one of the things we also now know, and there's a lot of talk within physio about this and within healthcare, is that it's one thing to have the information, it's another thing to actually make the behavioral change that then makes the information be something that's useful. So not just knowing that you can actually support yourself better, but finding out how and then implementing it. I think that's really important. So that would come back to what you're doing with people, which is exactly the concept of it is never too late to start strength training. You are never too old to lift. You can always begin to do activities that will help you to have better quality of life. It's never too late to start that. And I mean, I know we talk about you can't go wrong getting strong and all of these kind of cliches, but basically at the end of the day, the more resilience we have in our bodies to be able to withstand those daily stresses, the better. And with women, gravity is one of those daily stresses that impacts in a greater manner. So we have two elephants in the room sitting on our chest that have previously been ignored, and now that we're recognizing that they're, they mustn't be ignored, they need to be managed, and that can therefore feed so positively into all of the other things that help to give us better quality of life and health.
Yeah, totally agree. And yeah, hence the name of the podcast, it's never too old or never too old to lift. I'd never want it to sound patronising in a sense that I don't recognise the fact that age does bring about difficulties and barriers to getting started that people in the 20s and 30s don't often have to think about. And yeah, you've talked in depth about how breast weight is just another one of those barriers that people may have realised or not realised was affecting either the desire to start or the reason they keep giving up with it.
The ability to keep going.
So yeah, I can't thank you enough for giving up your time to come and sharing that, and I'm sure there'll be plenty of people who've been inspired or have learnt something that there is a possibility to make a change. And like I say, I think that's a really powerful message you are trying to send out there. So yeah,
thank you for the opportunity.
No problem. So I think if anyone has any questions As a result of this, you can either leave it in the comments on YouTube, and I will share those with Siobhan to see if there's any answers we can get from those. But like, we've got all the details, and I'll put all those links in the show notes. But for now, I'll let you get on with your day, and can't thank you enough.
Thank you.